Did you know that a woman can go through long and difficult labor not because of witchcraft, but because the baby's head does not fit properly into the mother's pelvis? Watch at the background and see what I'm saying. Today, I'll be explaining to you the pelvis and the fetal skull so that you understand it properly. And also, you should know the important sutures that determine whether labor will be easy or difficult. If you are a student or a healthcare worker, a midwifery, or you just want to understand childbirth better, this video is for you. Welcome to Medical Patho Television. My name is Patrick, and on this channel we explain medical and health topics in a simple, clear and correct way. In this video, we will talk about the pelvis, the fetal skull, why both are very important during pregnancy and labor. Please don't hesitate to watch this video till the end. Now, let's talk about the description of the pelvis. The pelvis is a bony structure and it's found at the lower part of the trunk. Watch it at the background, between the abdomen and the thigh. Let's go straight to the function of this pelvis. It supports the body, it protects the pelvis organs like the bladder, the uterus in women. That's what I would say. It forms the birth canal during labor for women. Now let's talk about the types of female pelvis or pelvis. We have 4 types of this pelvis, but our focus is going to be based on the most important ones. 1. The gynecoid pelvis. This is the normal female pelvis. It is round and wide. It is the best pelvis for childbirth. We go to the second one, and that is the android pelvis. More common in men. It is more common in men. It is narrower, can cause difficult labor. We have another one called the anthropoid pelvis. It is oval in shape. Labor may still be possible. We have the platyloid pelvis. It is flat, often cause obstruction during labor. The gynecoid pelvis is the most favorable for normal vaginal delivery. Part of this pelvis is important in labor. 1. The pelvic inlet. What's the pelvic inlet? That is the entrance of the pelvis. As you're seeing at the background, we have the mid pelvis. That is the narrowest part. The pelvic outlet. That is the exit where the baby comes out, as you are seeing it at the back. If any of these parts are too narrow, labor can be prolonged or obstructed. Now let me describe the fetal skull. The fetal skull is the head of the unborn baby, and it is the largest and hardest part of the fetus. That is why it plays a very important role during labor. Let's talk about the bones of this fetal skull. The fetal skull is made up of 2 frontal bones, 2 parietal bones, and 1 occipital bone, another temporal bone. These bones are not family joints like the adult. No, of course, they are not family joints like the adult. We have what we call sutures of the fetal skull. What is sutures? Sutures are the space, watch at the background, are the space between the skull bones. Why is it important? Sutures include the sagittal sutures, the coronal sutures, the lambdoid sutures. These sutures allow the skull bone to move and overlap during labor. We go to the 4th, which is the frontanels, which is also called the soft spots. Frontanels are the soft areas where sutures meet. The 2 main frontanels are the anterior frontanel, and it is like a diamond shape. Watch at the background. This helps healthcare workers to determine the position of the baby's head. Another one is the posterior frontanel. It is like a triangular shape, smaller and closes early. It closes very early. The frontanels allow the baby's head to mold during labor. Let's go to the next question. Why pelvis and fetal skull are important together? Now let me say this to you. During labor, the baby's head must pass through the mother's pelvis. This process determines on the size and shape of the pelvis. Oh yes, I know you can get it. I know you are understanding it. The size and the flexibility of the fetal skull should be there. If the pelvis is too small or baby's head is too large, labor becomes difficult or obstructed, which can lead to 1. What we call prolonged labor. 2. Fetal stress. 3. uterine ruptured. And for this type of people, in need of what we call CS, cesarean section. That is why understanding the pelvis and fetal skull is very, very important in maternal care. So now let me say this. Why do you think this topic is important? Drop in the comment section. This topic is important because it acknowledged you and helps midwife, nurses, and even doctors, and even pregnant women to understand why labor progresses well. 2, why labor becomes difficult when medical intervention is needed. So let me give you this one, and this is going to be the end. If this explanation helped you, like this video. I'm not your mate. Please subscribe to Medical Practice Television. Share it with students, healthcare workers, midwives, and expectant mothers, because this knowledge can really save lives. If it's your mother, your auntie, anybody, just share it to them. It is very important. Thank you for watching, and I will see you in the next video. I love you all. Tata.